Good afternoon. Welcome, everybody. Thank you so much for joining for this 2:15 session on mental health, HIV mental health and wellness. My name is Mabel Taplin, and I am a community liaison with Thera Technologies. And so before we get started today, I think it's important to introduce myself to you outside of my job title and my academic preparation as a registered nurse with a master's degree. I think it's important, as you all can see, I'm an African American woman. I am from the south side of Chicago. I am the only girl in the house. I grew up with a house full of men, my father, three brothers, and my mother. And so the lens that I look at mental health and wellness through is through the lens of this Black woman that grew up in the Midwest in a family that was probably a little bit dominated by men. So you'll hear some of these examples as we go through today's presentation. So you can expect for today's presentation to be about 45 minutes. There will be plenty of opportunities for question and answer. This is an interactive presentation, so feel free to ask the questions as they come to you. There are designed pauses in today's presentation, but I want to make sure that you ask your questions when they come to you, and then I'll get to them as soon as time permits. So sit back and relax and prepare to learn something for you, for somebody that you love, or somebody that is in your sphere of influence. All right, let's go. So let's talk about the objectives for today. We're going to talk about the importance of mental health for people with HIV and how to live and thrive, signs and symptoms and the causes of depression for people with HIV, loneliness and how to approach or counteract loneliness, strategies to fight HIV-related stigma, addressing depression with therapy, exercise, and mindfulness meditation. And then also, just a disclosure that today's presentation is an overview, and there's no product marketing, Thera Technologies that are mentioned in this presentation. Thera Technologies does not manufacture or market any products for the diagnosis or treatment of mental health conditions, and today's presentation is for educational purposes only. So let's start with the good news. So the good news is that people living with HIV are living longer than ever before. So when you look at this timeline, you see the life expectancy started to go up exponentially when we entered into the millennium with the advent of some of the protease inhibitors, integrase inhibitors, when we had new classes of drugs that really impacted the HIV life cycle. So HIV was not able to proliferate as fast as it was in years past. So we have something to celebrate, that people are living longer. The life expectancy of the general population is 79. And when I say the general population, essentially that's the majority in this country at the time. It means typically white men and white women. The life expectancy for Black men in the United States, the average is 69 years old. And the life expectancy for a Black woman is about between 76 and 77. We know that as a result of the pandemic, we lost about an average of 8 to 10 months on life expectancy on all race groups. But the point is that we are celebrating that people with HIV are living longer. And so what that essentially means, and we'll talk about it later, is as far as the health outcomes, HIV is no longer the death, the concern for mortality as it was in the past. So that's something for us to celebrate. So in 2020, Health HIV took a survey of people living with HIV, and they found that most people over the age of 50 reported experiencing depression, elevated cholesterol, chronic inflammation, high blood pressure, and nerve damage. And I would just like to say that this survey was conducted in 2020. And so I would venture to say that a lot of people outside of people living with HIV were dealing with some form of depression, because I don't know nobody that has experienced a pandemic and a lockdown in this lifetime. So addressing mental health concerns are important. Why? Well, number one is because we've taken the focus now off of prolonged life into quality of life, right? And so depression is the most common mental health condition reported amongst people with HIV. So now we're focusing on, shifting to integrate a more holistic view of what it means to be diagnosed with HIV, not just with, like I said, the physiological components, but also the psychosocial components, anxiety, cognitive dysfunction, and then insomnia. So we're going to talk about these later in the presentation, but these are the most commonly reported health concerns or mental health concerns for people with HIV. So the first thing we're going to talk about diagnosis is depression. What are the signs and symptoms and the causes? Depression refers to a group of mental health conditions that cause people to feel sad, empty, irritable for extended periods of time. So let me pause here and give you a little bit of caveat about depression, right? There's situational depression, life is happening, you're having a hard time, you feel sad. That is considered normal. The reason when we categorize prolonged depression is when you have some symptoms that are longer than 3 to 6 months and they're unrelenting, these prolonged. So that extended period of time, let me give you a number for that. That is, you can't attach your sadness to an event or that you're irritable, but that you're constantly in this state of sadness, irritability for months on months at a time, right? And so how does that impact your quality of life? Well, it can impact how you concentrate, how you complete everyday tasks, how you show up in the world, essentially, how you show up at work, how you show up if you're in school or even at home. So this last box where it says it's important to remember that sadness is normal. Yes, it is normal if you can attach it, to some obvious reason, or that the sadness comes and goes and it's not happening over a prolonged period of time. So how does depression feel? So this concept of loss of interest or pleasure in activities, let me pause there. It's number one. And I think that we should talk about this through the context of, like I said, as an African-American woman in particular, living in a house with African-American men. So my father had lung cancer during the pandemic, and he had lung cancer the year before, so 2019. And I was noticing, I would ask my father, he loved basketball, he loved going to the bar, beating up with his friends, he loved poker. And so I was trying to cheer my father up. He had been battling cancer for a couple of years. And there was something as a clinician, actually, as a depression specialist at one point in my career, I'm like, my dad is depressed. Right. And so I had reported to his physician, I think my father is depressed. And so I'm like, I think that he might benefit from being started on some antidepressant medication. And I had been asking my father, like, how are you doing? And his response was always, oh, I'm fair for a square. And so I'm like, no, Daddy, I'm watching you, like, can I take you to let's go out and watch the basketball game, etc. No, I don't feel like it. And so when I actually got him to the doctor, and the doctor is asking him questions about like using the word pleasure or loss of interest, my father's like, I'm fine, right? And so sometimes there needs to be some follow-up questions that are in the context of the person, because my father's canned response was, I'm fair for a square. Now, for a Black man that grew up in the 60s, the 70s, right? That was jargon for his age wrong. I'm fair for a square. Sir, you are not fair for a square. I live with you. I'm watching you every day, right? But for him, that wasn't an option for him to sort of say, well, I'm having a bad day, or I don't want. I'm like, I just offered to take you to the casino, to do all the things that I know that you like to do. And your answer is no. Not only is it no, but it's no over a prolonged period of time, right? And so his provider was like, well, I think he might be depressed, but he's saying he's okay. And also, when he would go to the doctor, he would put on his best clothes, right? Because his doctor, my father, was a attractive Black woman, and so he's still him, right? So he wanted to show up also in a way that is appealing to her. So the reason why I'm sharing this story with us is because I believe that we have to be cognizant of the context and the cultural context and the norms of the people that we're trying to assess, and even ourselves, and being honest with ourselves about loss of interest and loss of pleasure, and not just giving sort of canned responses. The other thing that comes to mind, particularly growing up in the church, when somebody asks you how you doing, and then you say, I'm blessed and highly favored. And I can tell you many a times, particularly when I was dealing with the depression and the stress of caring for parents that were chronically ill, I answered blessed and highly favored a gazillion times. And on the inside, I felt like I was dying. And so when we start to really unpack and peel back the layers of what it means for us to have loss of interest or loss of pleasure or sadness and emptiness, and some of it is that we have to unlearn these canned responses and really be self-reflective and honest about the way that we actually feel. Difficulty concentrating and making decisions. Sometimes that's decision fatigue, right? That you are the person, the go-to person in your family, and you're experiencing, people always coming to you, etc. So you might have decision fatigue, changes in your appetite, and it might be emotional eating. It might be not having an appetite at all. Difficulty sleeping. It might be you are sleeping too much or you're sleeping too little. Decreased energy. Again, we so used to pushing past our energy levels that I don't even know sometimes if we know when we have decreased energy, because a part of the makeup in some cultures is just keep going, keep pushing past. I don't have time to stop. It's on to the next thing. Sadness, anxiety, and emptiness don't go away over a prolonged period of time. And then guilt, worthlessness, and the desire to hurt yourself, or the desire to end your life, or you have the suicidal thoughts. All right, so a large percentage of people with HIV found that 1 and 3 have experienced depression. So we talk about rates of moderate to severe depression in older people with HIV as high as 63% compared to 18% of older people in the United States living with HIV. I'm gonna just click through these. What's the visual, what I just said? All right. So why is depression a serious problem? Why do we need to prioritize it, right? Because when you don't get help for depression, it can impact how you take care of yourself, your self-care. And then the other part of that, even as you're attempting to address the mental health, you may turn to other ineffective coping mechanisms such as drugs and alcohol to help you to feel better. And so even while turning to drugs and alcohol, and overeating, those things can potentially have a negative impact on your everyday life. So here you are experiencing, a mental health challenge, and then you turn to something to sort of help you cope, but then that leads to some other issues that may show up in your life, such as addiction. And then it can also impact how you adhere to your medication regimen. So we want to highlight that it's important to address depression and not just brush it off, but we have to address it because it can impact more than just your mental health. So how does depression impact your physiology or your body, right? So here's something that I think all of us need to be mindful of, myself included, is that when you have a mental stressor, it does have a direct impact on your immune system. Let me say that again. Outside of people with HIV, anybody, if you have prolonged mental health stressors, it can impact your immune system. And your CD4 count is a member of your CD4 system. So we think about how our immune system works. It works on feedback loops and symbols. I'm pausing. I'll give you all a little bit of a biology lesson, just a little bit, right? And so what that means is sometimes in our brain can signal things called neurotransmitters and hormones to say, hey, we got a problem, do something about it, right? And so sometimes when you have a cut on your finger, you can physically see that it's a problem and your body is responding by sending blood to the site, rushing with immune cells in the blood to address the cut, right? But what happens when you feel a mental stressor? And your immune system, by the way, lives in your digestive tract. And so some of the hormones that our body uses to cope with stress internally can start to be stretched, or they can be low. And so our immune system is responding internally, right? So that's where sometimes when people have anxiety, they report having like a bubbly stomach, or some people get a headache, or they get palpitations because their body is going into fight or flight response. Those are all examples of what's happening internally to our body when we are under mental stress or stress. And so we don't necessarily make those connections in our everyday lives as far as mental health, but I need for us to walk away from today's talk. If you don't walk away from anything else, understanding that how you feel, how you process, and how you manage stress does in fact impact your immune system. So even people with HIV that are undetectable with depression can increase their viral load. So here's one of those chemicals that I talked about. Norepinephrine is a brain chemical related to emotions and stress that has been shown to speed up viral replication and lower the impact of medication. Remember, I talked about those feedback loops and the chemicals, the hormones that our bodies work on. So we want to make sure that high norepinephrine levels and depression can lead to your immune system working harder and your CD4 cells dying, right? And which in turn gives the HIV virus an opportunity to proliferate in your body. All right, so loneliness and stigma and depression go hand in hand. Let's talk about it. Causes for loneliness and how to approach counter it. So loneliness is a subject experience of feeling distressed over having fewer actual relationships. And it's reported that people over 50, particularly people with HIV over 50, loneliness is more common. Again, loneliness is actually more common as we age because people typically stay in their same communities and they get sort of caught in to routine, particularly as we're coming out of this pandemic, what is normal, right? We did such a good job of, I would say, firing the alarm for people to stay inside to protect themselves, et cetera, et cetera. And now we're having to unlearn being guarded, right? And so you think about, you had a lifetime, a couple of situations in your life where if you are definitely in your 50s and 60s, outside of surviving a pandemic, outside of an HIV diagnosis, it typically is challenging to make new friends, move to new communities. And so you resolve to keep it to yourself. So between 22 and 58% of people with HIV said that they reported ongoing loneliness. All right, so here we go. This is really to draw a parallel again about our mental health and how it can impact our bodies. So I'm saying loneliness and I'm drawing parallels on the different systems in the body on how this mental component of loneliness can impact somebody. So we have heart disease, dementia, inflammation. Listen, inflammation is just another word for triggering your immune system, right? Inflammation is the process that happens when your immune system is triggered. Decline in physical functioning, an earlier need for long-term care, and then poor diet and exercise habits, again, because sometimes when we eat food, you get a dopamine response. I'm just trying to feel better. Anybody else emotionally eat? I am an emotional eater. There's plenty of things in my diet I'm not supposed to have, but then when I'm having a rough day, I'm like, oh, just let me have a piece of pizza. I am so lactose intolerant, and pizza and cheese is the devil for me. But when I'm stressed, I make bad eating habit choices. I know I'm not alone, but I am also sharing that because the other part of when we see things like this and we feel lonely, you can feel like, wow, I'll never get it all the way right. None of us are checking off the boxes for not being lonely and not being depressed. Again, I want to make sure that the context is proper, is that it's prolonged and there's no interruptions if you are experiencing loneliness and depression, and then how it can show up and impact these other areas of our lives. So here's another aha moment that I think should sort of build the case on why we have to actively work on addressing loneliness. Loneliness has the same impact on mortality as smoking 15 cigarettes per day, and it has more impact than obesity. So why did we choose to highlight the impact of 15 cigarettes? Because you see stop smoking campaigns all over everywhere, right? And so there is this concerted effort to raise awareness about smoking, but you don't see a sign about loneliness. So let me attach to something that has more of a social norm of urgency, right? And that's smoking. So if everybody identifies, like I said, my father died of lung cancer, right? So I saw how lung cancer negatively impacted him, but I didn't necessarily see, because he was experiencing a chronic illness, how he had started to withdraw and he wasn't seeing his friends and he wasn't really opening himself for relationship. But I was able to see that, oh, Daddy, could you please stop smoking because it's increasing your risk for cancer. I saw all of that before he was actually diagnosed. But I didn't necessarily prioritize seeing how his life was changing and he was becoming a little bit more reclusive as he was aging. So let's talk more about living arrangements amongst people with HIV. So 14% of those that were surveyed in 2018 reported living with a spouse, 16% others, but then 70% reported living alone. Wow. The relationship between loneliness and living arrangements is particularly stronger for older people with HIV. So what proportion live with a spouse and children? Look at that. Proportion of people with HIV with a primary spouse is only 15%, and 85% without. And then with children, 62% don't live with children or have children, and 38% have children. So loneliness can be related to trauma experienced from surviving the early ages, the early part of AIDS, and the loss of entire social networks during the early HIV epidemic. I was watching a clip of Shirley Ralph just a couple of days ago, and she was talking about when she was on Broadway, Dreamgirls, and how she was living out her dreams, but she was also living out a nightmare at the same time. It's because the people that she loved, the people that she had camaraderie with, at the time were dying of HIV and AIDS. And so we still have to acknowledge, I was on Brian's talk earlier today about long-term survivorship and what mental toll that can take on individuals that are survivors of the early HIV epidemic crisis. And so we have to acknowledge that feeling of guilt and remorse and how that shows up in your conscious and unconscious. So what can we do about loneliness? Here we go, support groups. We need support groups. We are in a time where support groups are dying. And so a large part of the conversation that I'm having out in the community particularly post-COVID, is how can we revamp support groups, and how can we become more innovative? We need your help. I remember this past summer at AIDS 2022, the recurring informal theme was nothing for us without us, right? And so we already know the value of a reliable support network. And we also know the reliability of, or the impact of reaching out and encouraging and connection. Humanity needs belonging. That's not unique to people living with HIV. Community and belonging is a core basic human need. And then adopting an emotional support or therapy animal. I always like to add that of my friends, they have pets. I've never heard anybody in my sphere of influence call their pets emotional support or therapy animals. So if you see that on the screen, you might not call it an emotional support or therapy animal if it is your pet. And I can attest that during the pandemic, locked in an apartment by myself, I almost was getting a dog. The lady almost got my money until she said that the dog was going to live for 15 years. And I was like, I ain't been able to commit to nothing for 15 years. That's a stretch. So I opted out of getting the support animal. This other one, cultivating new relationships. This one is particularly challenging. Again, as I said, as you age, it gets harder to open yourself up to new relationships. But I want to challenge us today to step outside of our comfort zone and create opportunities to identify safe spaces for cultivating new relationships. So here's some other strategies for meeting new people: book clubs, games, travel groups, arts, cooking groups. So basically finding something that you have in common with people and using that as a bridge to build relationships. Community groups, cultural groups. So essentially the real crux of all of these examples or activities is to figure out how you can get your body and your mind outside of yourself. Because when you are alone, you tend to ruminate on your thoughts. And then also when you're outside in other spaces, it gives you something else to focus on. So these are just examples that you can do in person and or online. So here's an opportunity for you to look for additional resources near you. Health HIV has a website that can provide you with organizations that provide assistance for HIV, HCV, and the LGBTQ+ community. So feel free to visit that. And then let's talk about strategies to fight against stigma. So I think this is really important because we want to define stigma for the context of this conversation. Enacted is prejudice, maltreatment, and discrimination against people with HIV. I hear you, Brian, about how people experience stigma earlier in the day. Felt stigma, fear, shame, and guilt that can be internalized by someone living with HIV. And then intersectional, how do they intersect? HIV-related stigma that's complicated by one's identity, such as race, ethnicity, or I would say gender identity, and also sexual orientation. So people with HIV who experience HIV-related stigma, now we're talking about vulnerabilities, right? That you might experience fewer social networks, you may feel socially isolated, your self-esteem might be impacted, and you may also have issues with functioning in your day-to-day activities, and that in turn can impact depression. So here's a staggering statistic in 2020 that said 96% of older people with HIV are experiencing some form of HIV-related stigma. So the point of this slide really is to validate that stigma still exists, that it exists in the HIV community, and that I see you, we see you, and that there are things that we can do and continue to do, which is what this conference is about, to combat stigma. Here we go. How do we challenge enacted stigma? Well, we can help dispel misinformation and misconceptions about HIV and how it's spread. We can also celebrate and emphasize You Equals You campaign, and then we can celebrate positive role models and allies. So we want to empower people for partnership, because it can't just be on the onus of people with HIV. It has to also involve those around us with an HIV diagnosis. And then how to challenge felt stigma. I think this is very important, to give yourself permission to seek support from a licensed mental health professional, and to really give yourself permission to be vulnerable and work towards self-acceptance. This is a big one. Even I use my father because he was an older Black man. He was 69 when he died, but I have 3 younger brothers, 2 of which are in their late 30s and 1 is in his early 40s. And when I tell you that I have the hardest time trying to get them to engage with any healthcare provider, whether it's a mental health provider, whether it's a primary care provider, there is definitely medical mistrust when it comes to accessing services. And so I do want to acknowledge that in this conversation, but I also want to empower us with tools to say, okay, even if I know that, there is barriers to accessing care that exist, I can no longer opt out, but I'm going to use resources to help me sort of empower me to pick the right provider for me and just start the process, because not every provider is a good fit for a patient. And I think we need to say that out loud more. And I think also that the whole point of having a licensed mental health professional is so that you can express what you are feeling in a safe, non-judgmental space. And so seeking out these spaces and giving yourself permission to be vulnerable and transparent can also be very helpful to managing your mental health and also any underlying depression or anxiety that you have. And then consider volunteering. So there is actually medical research that validates that volunteering and expressing gratitude can actively address mental health conditions and also felt stigma. All right, so here's some examples of language. Language matters. So here's how we can start to transform. Instead of saying AIDS, say HIV or HIV and AIDS, catching or passing as if it's a football, using the proper medical diagnosis as diagnosed or acquired HIV or transmitted HIV body fluids. Call it what it is: blood, semen, vaginal fluids, etc. Victimization, absolutely not. A person, people, we have to sort of humanize and continue to humanize folks in whatever they're dealing with in life. It's not just people with HIV again, but figuring out how we can be more empathic and making sure that we are conscious of our language and how we are referring to people. AIDS, HIV patient, again, sort of changing. I'm a people first. It's people first language. Acknowledge my humanity first before you sort of categorize me by my chronic illness. And then HIV positive person or person with HIV or person with AIDS. So treating depression. Here we go. What can we do? First one up, talk therapy, right? That's probably one of the hardest things to do sometimes, is to be vulnerable and talk about how we're feeling. So let's talk about that. We have to take away the shame and the guilt felt about seeking therapy. It's affirming, and it's empowering. And then there are different kinds of therapy, right? It could be personal, it could be one-on-one, it could be in a group, as long as there is a licensed healthcare professional. And it doesn't have to be a long-term commitment. It could be a couple weeks. It could be, it could be a month, it could be years. I personally go in and out of therapy all the time, depending on what I have going on in my life. And I think being transparent and making sure that we're normalizing accessing therapy and the different kinds of therapy that is available to us helps to decrease and alleviate the stigma associated from seeking mental health counseling. And then remote therapy is an affordable option in case you don't want to physically go to a therapist. So here are some resources for online therapy resources. And also at the end of today's presentation, we will have a handout. So I have to figure out how to get that to you all just so that you don't have to worry about taking notes. All right, here's some other mental health resources. All right, so let's talk about exercise. Regular exercise can ease depression and anxiety by, so here it is, that's another hormone, feel good endorphins. Anybody ever heard of endorphins? So endorphins are released, and it really does have like a euphoric impact on your body. Again, our bodies work on hormones. Distraction, exercise, listen, you outside or whatever you're doing, you're working hard, you're not thinking about whatever it is that is keeping you depressed. So it's a good distractor. It can be a boost of confidence. And if you are into group exercise, it could be a way for you to gain more social interaction. And then it is also a positive coping mechanism as it relates to exercise. So let's talk about one of my favorite things, mindfulness meditation. So mindfulness is the practice of learning to focus your attention on the present moment. It involves sitting or lying still or focusing on your breath or different parts of your body. That's called a body scan. And then mindfulness-based stress reduction. So I'm going to take us through a little bit of mindfulness exercise because I think it's important. Y'all notice that my voice changed because I want to get present, right? Because I want y'all to know how to do this when you get out of this webinar today. Okay. So for example, I'm seated. And I could just really start to calm down and just give myself permission to be in my body. So in my body, I remind myself that my feet are on the floor. And I want us to close our eyes wherever you are and say, wow, what does my feet feel like on the floor? How do my calf muscles feel? Are they tight? Do I feel them at all? What's happening with my knees? Let me feel the back of my thighs in this chair. This chair is hard and it's uncomfortable, but I'm here. How do I feel in my chest? As I take a deep breath and I blow it out, how did that feel? Was the air cold? Was it warm? Let me take another deep breath. Blow it out. How do my hands feel? Do they feel tingly? Pause. You can open your eyes. So just in that moment, I felt all of my engagement and excitement go all the way down. You can do that at any time, at any place. Just pause and bring your mind back to the present. That's why it's called mindfulness. So I want to invite you. There are plenty of videos on YouTube that you can use for mindfulness practice. It doesn't have to be long. That's the other thing I think that can be really intimidating when we think about meditation, is that we sort of think about these extremes. But even in that moment, feeling how your body is, even in space, can be very soothing to your nervous system and also to your immune system. So here's some mindfulness meditation resources: the Calm app, Insight Timer, Headspace.com, My Life, and Keely Meditation are all resources to help you get through a mindfulness meditation. And like I said, they can be any length of time. So 3 of the most common classes of antidepressant medications, just to give you some information in case you need support, pharmacological support. So serotonin reuptake inhibitor. Serotonin is a hormone that regulates our mood, serotonin and dopamine. And so just to give you all just a little bit of more science, serotonin typically, the serotonin receptors typically line your GI tract, right? So a lot of side effects of some of these medications, they include some kind of side effect in your GI tract, and that's why. And again, norepinephrine, remember we talked about sometimes as we've been coping over time, we have an imbalance in these hormones, serotonin, norepinephrine, and I'll throw in there dopamine. So this is just a really high level view of some medications that can be used to treat depression. All right, so in summary, mental health care is a key component of wellness and resiliency for people with HIV. There are tools to combat loneliness and stigma, two core causes of depression for people with HIV. And depression is the most diagnosed mental health condition with people with HIV, and there are numerous support systems. So although we're shining a light on depression, loneliness, and stigma, I want to encourage you today that there are resources for you to manage depression, loneliness, and stigma. And I want to thank you so much for your time today. And so now it's time for questions. Any questions, you can go off mute, I think. So let's start with, how am I doing time? Okay. So Larry, thank you for your comments. It says, we are taught as persons of color to push on and work through it. Yes, absolutely. And then support groups and being around positive people is helpful. Agreed. And then, do you have a preferred video on YouTube for mindfulness? Okay, yes, I do. There is a guy, his name is Jason Stevenson. And then there's another guy, his name is Dr. Joe Dispenza. So I guess I should put these in the chat for you. All right. Any other questions? You feel free to come off mute if you want. You're a quiet group. I don't know what to think about that. Ramona has her hand raised.
Oh, yes. Hi. This was just a wonderful talk. I'm a psychiatrist, and I'm new to an HIV/AIDS clinic. So this is a new realm for me. But I just wanted to say I so appreciate the passion, the details, how complete you were, because I do think, unfortunately, accessing mental health treatment, as you said, it's so stigmatized in the Black and brown community. It's like not okay to be, it takes me a long time to form a therapeutic relationship with my Black and brown patients to even get them to consider being on an antidepressant, which can be part of a complete treatment for depression, as you're saying. And I try to tell my patients, I am a holistic provider. I want to know, how are you sleeping? What is your sleep routine? Because sleep is a vital component of treating depression. What about what you're putting in your body? Alcohol, drugs, things like that are very powerful central nervous system depressants. And some people don't realize, well, they'll say, well, I have a few drinks before bedtime to help me to sleep. Well, that absolutely disrupts the sleep cycle. It ruins the, sleep architecture. So I ask people, what are you putting into your body? Caffeine, cigarettes, your nutrition, as you said, your exercise, stress reduction. How are you taking care of yourself? Where are your social connections? Are you, oh, I don't feel like it. I'm not motivated to do anything or see anyone. Well, when you isolate yourself, that's like throwing fuel on a burning flame. So I try to educate people that even though you don't feel like it, There's certain things that you might have to push yourself to do while you're getting out of the depression that can actually help you feel better.
Yes.
And one last thing I want to comment on, because I do think sometimes, especially in the Black community, there is a misunderstanding. Sometimes people will say, well, of course I'm depressed. Look at what I'm dealing with.
Yeah.
I can identify all of these things. Wouldn't you be depressed if you were in my situation? But we want people to understand that your situation can actually shift your neurotransmitters, can
Mm,
change your biology, can
mm,
affect your immune system. So
mm,
just because you can identify what's causing you to feel down, it doesn't mean you don't need treatment for depression. Um, and as you were saying, if your feelings of feeling down, not getting pleasure, certainly any suicidal thoughts, if that is consistent over time, and some of us will say weeks, even though you can identify what's causing it, it would be very important for you to seek mental health treatment. So anyway, you just gave a wonderful, wonderful talk.
No, and I'm so glad that you commented because I cut the talk down actually. So this is really good. It sort of fills in some gaps that I actually left out. One thing that comes to mind, which is what you're saying about why it's important to seek mental health and in a holistic way, is that the reason why people start on antidepressant medications is because over time there is a physiological deficit that occurs, right? And so a lot of the medicines, either unless you're predisposed physiologically, but a lot of the medicines are designed to help fill those gaps where you have low serotonin levels. And so, not to get too technical on why it's important, also, if you needed to start on antidepressants, it's really because long term, your body has been trying to cope at a chemical level. And then you actually have a deficit that needs to be filled with help with getting more available norepinephrine and serotonin. And so that's where the space of pharmacological intervention is important. And then the other thing that you said about essentially the impact that racism and structural violence has on our community is this concept of resiliency, right? And sort of resiliency is a muscle, and how we manage not only mentally what we're dealing with structural violence, but also I think physiologically with building those new neural pathways on how we cope with prolonged stress. So thank you so much, Ramona, again, for your comments. I really appreciate them. And I'm going to go back. All right. Hey, Jeff, my buddy. Jeff says, how do we monitor inflammation in our bodies? Jeff, that's a really good question. I think that there are a couple things. We have signs of external signs of inflammation, but I think it's a conversation that you can have with your doctor. But also it can translate to our everyday choices and just trying to make choices that influence what we eat, how much we sleep, that we know impact inflammation, i.e., there are some of the foods that we eat are highly inflammatory, and our dental care, gingivitis, gum care, these low level things that we don't necessarily associate inflammation with. Dental care is a big one. Taking care of your teeth, it can decrease inflammation in your body. Also, like I said, your diet and exercise at least 30 minutes 4 times a week. Can also decrease your overall inflammation levels. There are some tests if to determine if you have like an acute infection and inflammation, but I don't think that those tests are necessarily always available to the general population. So I will reframe your question, Jeff, to say, instead of how do you monitor inflammation in your bodies, in our bodies, I would say, what everyday choices can I make that will reduce my risk of prolonged inflammation? And so those everyday choices is investigating what an anti-inflammatory diet looks like. You can Google that, and it helps you to sort of understand how your food choices can also influence inflammation in your body. Also, diet, exercise, moving your body in a way, and taking care of your teeth. Those will probably be my top 3. There's some other ones, but I'm gonna run out of time. Joanne, can I show the summary slide again? I absolutely can. Thank you so much, Larry, for your kind words to me. And are there any other questions for me? No? Yeah, these are my favorite things to do. All right. Well, thank you so much for spending time with me on this Wednesday afternoon. Let me see somebody else. I hope that I will see you guys on Friday. Thanks, Rhonda. Hope I'll see you guys on Friday for the opening session. I am the keynote speaker. All right, so enjoy the rest of your Wednesday and the rest of the conference. Take care.